Hello everyone, today's topic is in continuation with the dural venous sinuses. It is the paired sinus and most importantly sinus that is asked during the examination. It is cavernous sinus. So, location, it is on each side of the body of the sphenoid, and this is body of the sphenoid. This is the body of the sphenoid. Now its location is on each side of the body of the sphenoid, and it extends anteriorly up to the superior orbital fissure and posteriorly up to the apex of the petrous temporal bone. Now in this diagram, this portion is the superior orbital fissure. This is the superior orbital fissure, and here is the apex of the petrous temporal bone. Length, measurement of the cavernous sinus, length is approximately 2 cm and breadth is 1 cm. So why it is termed as cavernous sinus? In the cadavers, when we do dissection, we found this sinus is spongy in appearance. During dissection, the sinus is in collapsed position, and during dissection we found that the sinus is traversed by the interlacement of the reticular fibers is collapsed. It contain the reticular fibers, and these reticular fibers make the sinus spongy in appearance, and that is why we termed it as cavernous sinus. In adult or in the normal living person, sinus is distended. Now development, sinus is developed from the cephalic part of the primary head vein. And what is primary head vein? It is the rostral continuation of the anterior cardinal vein, and incorporation of the plexiform tributaries during the development makes the interior of the cavernous sinus trabeculated. Now formation, each sinus is formed by the separation between the two meningeal and endosteal layers of the dura mater, and sinus is filled with the venous blood, and it is covered with an endothelial lining. So the roof and the lateral wall of the cavernous sinus is formed by the meningeal layer of the dura mater, whereas floor and medial wall is formed by the endosteal layer of the dura mater. This is the body of the sphenoid. If we see, so roof and the lateral wall is formed by the meningeal layer, whereas this floor and the medial wall is formed by the endosteal layer. If this is the body of the sphenoid, the roof and the lateral wall are formed by the meningeal layer in red color, and the floor and the medial wall is formed by the endosteal layer of the dura mater. In between we have endothelial lining for sinus and venous blood. Now content, one major artery that supplies the cranial cavity, that is the internal carotid artery, and second content are nerves, that is third nerve, third oculomotor, fourth trochlear, V1 division of trigeminal, that is the ophthalmic nerve, V2 division, that is the maxillary nerve, and sixth nerve, that is the abducent nerve. These and sympathetic plexus around the internal carotid artery. These are the content of or the structure passing through the cavernous sinus. How to remember the nerves? 3, 4, oculomotor, trochlear, V1 division, that is the ophthalmic nerve, and 6. These 3, 4, 5 V1 division and 6, all these 4 nerves crosses the cavernous sinus, are the content of the cavernous sinus, and they passes through the superior orbital fissure to enter into the orbit to supply the eye of muscles, except the V2 that passes through the foramina rotundum. So contents. Now in this diagram we will see these are the nerves, that is the oculomotor, trochlear, ophthalmic, maxillary and abducent nerve, and sympathetic plexus around the internal carotid artery. And second content is internal carotid artery. This is the major content. Now in detail, first of all, internal carotid artery. Now it is surrounded by the plexus of the sympathetic nerves and the veins. It enters through the apex of the petrous part, passes along the floor of the sinus. It enters from the floor of the sinus in the carotid sulcus of the body of the sphenoid. In the carotid sulcus of body of sphenoid. Internal carotid, branch of common carotid. From neck it enters the base of the skull through carotid foramina, and it enters through the apex of the petrous part, and it passes along the floor of the sinus, lodge into the carotid sulcus of the body of the sphenoid, and later it turns upward and pierces the roof of the sinus. See in the diagram, this is around the floor, and this is also internal carotid artery. It piercing the roof of the cavernous sinus through the carotidoclinoid foramina. Carotid sulcus of the body then pierce the roof and come out. It takes a backward and then a forward turn, that siphon of the internal carotid artery that we will study during the lecture of the internal carotid artery. Now second content is abducent nerve, that is cranial nerve 6. It enters below the petrous sphenoid ligament and accompanies the inferior lateral to the internal carotid artery. This is as the position of the cranial nerve 6 in relation to the internal carotid artery. It is inferior lateral to internal carotid artery. Inferior lateral to the internal carotid artery. Both these are towards the floor. Internal carotid is medial and abducent nerve is lateral, inferior lateral, below and lateral. Now structures in third we will study structures. This is also asked. Structures within the lateral wall of the sinus. Lateral wall of the sinus. From above downward, if we study, above is cranial nerve 3, that is the oculomotor nerve. It enters by piercing the roof of the sinus. It enters by piercing the roof of the sinus. And 6, an internal carotid, enters by piercing the floor. Internal carotid artery again pierces the roof to come into the cranial cavity. It pierces the roof of the sinus and leaves the sinus through the tendinous ring by dividing into the two rami. Tendinous ring, that is the ring related to the eye muscles. Second content is trochlear nerves. It similarly enters to the oculomotor nerve and leaves the sinus through the superior orbital fissure outside the tendinous rings. These structures passing within the tendinous rings and outside these in the superior orbital fissure, that is the another topic. Just remember, structures in the lateral wall of the sinus are cranial nerve 3, 4, V1 and V2 in order from above downward. 3, 4, V1, V2. 3 and 4 come by piercing the roof and they enter the superior orbital fissure to supply the muscles of eye. Now V1, that is the ophthalmic division of the trigeminal nerve, enter by piercing the cavum trigeminae or lateral wall of the sinus. V1 and V2 both pierce the lateral wall of the sinus. 3 and 4, trochlear nerve, these came from above, enter the sinus and leave through the superior orbital fissure. V1, V2, the cavum trigeminale is at the cavum trigeminale is for the ganglion, for the ganglion of the trigeminal nerve, and that is positioned behind, just behind and lateral to the cavernous sinus. And these V1 and V2 enters through the lateral wall by piercing the lateral wall within and enter into the sinus. And V1, that is the ophthalmic division, supplies the orbit, so it enters the superior orbital fissure. And V2 gives supply to the face, so it won't enter the superior orbital fissure. It leaves the sinus through the foramina rotundum. This is the main point, that V2 enters the sinus but leaves through the foramina rotundum. Rest 3, 4 and ophthalmic and even cranial nerve 6 enter the superior orbital fissure to supply the muscles of eye. Now, external relation of the cavernous sinus. Medially and below, if we see in the diagram, now if we see in this diagram, we have external relation. Na? So this is the midline. This is the midline, and medially what we see, this is the hypophysis cerebri and sphenoidal air sinuses. This is the stalk of the hypophysis cerebri, this is the hypophysis cerebri, and these are the sphenoidal air sinuses. So medially and below we have the hypophysis cerebri medially, and below we have sphenoidal air sinuses. Laterally we have cavum trigeminale. There is cavum. Laterally we have cavum trigeminale. Therefore V1 and V2 enters the sinus via piercing the lateral wall. This is ophthalmic and maxillary division of trigeminal nerve. So laterally we have the cavum trigeminale containing the trigeminal ganglion, and in posterior, and that is posterior inferior part of the lateral wall. And another relation is uncus of the temporal lobe. Now what above? Above we have optic chiasma and internal carotid artery. So this is above, this is lateral, and this is medial. Above we have optic chiasma, internal carotid artery that turns backward and then upward after piercing the roof, and the course of the artery within and above the sinus describes a U-shaped loop that is termed as the carotid. Now tributaries from the orbit we have superior ophthalmic vein, a branch from the inferior ophthalmic vein, and central vein of the retina. And from the meninges we have sphenoparietal sinus and the middle meningeal vein. And from brain we have superficial middle cerebral vein and inferior cerebral vein. These are the tributaries. Now what are the draining channel? The draining channels are the superior petrosal sinus and the inferior petrosal sinus that drain into the sigmoid and the transverse sinus. Now communication, it communicates with the transverse sinus through via superior petrosal sinus. It communicates with the transverse sinus via superior petrosal sinus. It communicates with the internal jugular vein through the inferior petrosal sinus and the plexus of the veins around the internal carotid artery. Now with the pterygoid venous plexus, it through the emissary vein which passes through the foramina ovale, foramina spinosum, foramina vesicae, and foramina lastrum. With the facial vein, it communicates with the facial vein by two routes, superior ophthalmic vein and the angular vein. Superior ophthalmic and the angular vein, and pterygoid venous plexus and deep facial vein. And second route is the pterygoid venous plexus and the deep facial vein. And with the opposite cavernous sinus via intercavernous sinuses, that is the anterior and posterior intercavernous sinus. So these are the communication. It communicates with the transverse sinus with internal jugular vein with the facial vein, and all these communication leads to facial vein. This angular vein comes in the danger area of the face. So any facial infection may spread to the cavernous sinus. Now some clinicals. The septic thrombosis of the cavernous sinus may be caused by the numerous communication from the dangerous area of the face, orbit, and the pharynx. This is manifested by the severe pain in the eye and forehead along the distribution of the ophthalmic nerve, that is termed as ophthalmoplegia, due to the involvement of the third, fourth, and sixth cranial nerves, marked edema of the eyelids, that is with exophthalmos, that is eye looks outward due to congestion of the orbital veins. It may be unilateral, may be bilateral. And if the internal carotid artery is ruptured, then it leads to pulsating exophthalmos with the partial or the complete ophthalmoplegia. Thank you.